Greetings from Heartcare Foundation of India and eMedi News. Welcome to our show, Chat with Dr. KK. We have with us Dr. Sanjay Gupta. He is a senior orthopedician at Mulchand MedCity. Earlier he was in UK and he is an expert in joint replacement surgery, and specifically in the knee and sports medicine. What we are going to interact with you is that long time back, Sachin Tendulkar created an awareness amongst public about tennis elbow.
That's right.
To the extent that people thought that for the treatment of tennis elbow, you have to go to Africa. So there is one specific African doctor who treats all our sports personality. Do you feel, what is that classical thing? What is that hunar in that African doctor that we don't have?
Well, to be honest, there is nothing like that. There are so many centers in India as well as abroad where sports injuries are treated. And as far as treating sports injuries is concerned, one has to have a very good understanding of pathology of the condition and to be able to decide whether this needs a surgery or not. So decision making is very important. And I guess
when it comes to tennis elbow, first of all, let me know what is tennis elbow.
Tennis elbow is something wherein there is an inflammation around the insertion of the extensor tendons of the arm, which is the tendons on the back side of the arm inserted onto the outer side of the elbow.
So it is a simple inflammation which can be picked up by an ultrasound and if required an MRI. So once you have confirmed there is an inflammation, when do we need surgery that you have to send the person?
So most tennis elbow cases get better by conservative treatment. They don't require surgery. But in sports personalities where they have to use their hand repeatedly, so the inflammation keeps on going, and when you can't have a period of rest for a prolonged period of time, it doesn't heal, it doesn't get better. And then there comes a time one has to decide as to whether if you want to continue playing sports and it's not getting better, you can't afford to have a period off from sports, then yes, surgery is quite successful.
Okay, so in those cases, injections will not work. The cortisone injections will not work.
That's right.
You have to go for surgery. What do you do in surgery there?
A surgery, basically, it is partial release of a particular muscle wherein there is inflammation, muscle which is attached onto the bone, and that is called as extensor carpi radialis brevis. So that muscle is not taken off completely from the bone, its partial origin is taken off, and gradually fibrosis develops, inflammation settles down, and tennis elbow heals.
So there is a requirement of tennis elbows that the message should go to the public is that if you are not a sportsman, then surgery is not for you.
My message to most people would be tennis elbow generally would get better by conservative management.
When say conservative means exercise, ultrasound, and then
massage. Massage is very important. Stretching of the tendon is very important because stretching and massage would heal most cases over a period of time.
And only for people who are like Sachin, they need surgery, not a common man.
Certainly, I would Sachin or sports personalities.
Obviously, people like Sachin.
That's right. That's right.
So what Sanjay talks about when we talk about tennis elbow is the message to the public should not go that if you have a tennis elbow, you may require surgery. Surgery is required only for players who are playing at an international level and they cannot afford to have off from playing. That only we do. And let's thank Sanjay to be with us on this show. That's all for today. We'll come back with one more show. Till that, goodbye. Thank you.